As a female, are you also considering going for a permanent contraception and laparoscopic sterilization is one of the options you are considering? Then this video is right for you. In this video, our top gynecologist Dr. Deepti Agarwal will tell you everything you need to know about this surgery.
Hello everyone, myself Dr. Deepti Agarwal, working as consultant obstetrician and gynecologist at Lifeline Hospital, New Delhi. I am here to speak about the topic on sterilization or tubal ligation. First of all, let me tell you, laparoscopic tubal ligation or laparoscopic sterilization is one and the same process. Basically, here we are here to speak about the female part of sterilization, and that is called as tubal ligation. As females have two fallopian tubes, and in the laparoscopic method of sterilization, we put two Falope-rings in each fallopian tube, so that the process is called as tubal ligation or laparoscopic sterilization. Any female who has completed 35 years of age or who has given birth to a child around 4 years or 5 years back can go for laparoscopic sterilization, as the child must have completed all the immunization by the age of 4 or 5 years. Now the prerequisite for sterilization is the haemoglobin level of the female should be at least 9 or above 9 gram percentage. Laparoscopic sterilization is a daycare procedure which could be completed in just a span of 24 hours or maybe 16 to 18 hours. The patient gets admitted on the same very day of surgery. A small anesthesia in the form of IV sedation is given. The process is completed in a span of hardly 15 to 20 minutes and the patient could be discharged by the evening. It is a very easy daycare procedure and the recovery rate is also very high, because the patient does not have to take many precautions after the surgery. He can well get started with his daycare routine things the day next or maybe in a day 2 or 3 of the procedure. Because in laparoscopic sterilization, we are not opening or we are not giving incision on the entire abdomen, and only a 2 to 3 centimeters of 2 holes are made, so it is a easier process in the way of performing also and also in the process of recovery. Sterilization should be done only after the patient gets his menstrual cycle or menses. Any day between day 3 to day 7 or 8 is the most likely or good period to go for the process of sterilization. So I would encourage everyone to go for the process of laparoscopic sterilization and have the information in their nearest hospital from their own gynecologist. Sterilization is the process of family planning in which we ligate or we basically clip the fallopian tubes so that the female does not conceive anymore. And it could be done by laparoscopy method as well as by open method of laparotomy. In this era of 21st century, we usually prefer to go by laparoscopic method. Why? Why laparoscopic method should be preferred? Because laparoscopic way of sterilization is a very easy and a daycare procedure. Basically, it should be taken over or it should be done by females who have completed their family in the age group of maybe 35 to 40 years, and we normally ask females who have the last childbirth or the birth of the last child should be at least 4 years of age, because by age of 4 years the child must have completed all the immunization, and it is a more preferred method and also a safe method of sterilization. In the process of laparoscopic sterilization, the fallopian tubes are basically clipped. We have a ring of tubes which we put by laparoscopic method by a simple procedure in which we just make a hole of 2 to 3 centimeters. We insert the laparoscope we insert the instrument and the camera, and we put both the fallopian clip, that is called as Falope-ring, over both the tubes. And it is a very simple process. After surgery, the patient can be discharged on the same very day after 4 to 5 hours. And the anesthesia is not very long. It could be done in a spinal anesthesia process also, or it could be done in a short IV sedation process also. So I would recommend all those who have completed their families should go for laparoscopic sterilization process. Now the other thing is, there is a 0.1% failure rate of laparoscopic sterilization or any kind of sterilization process that you have chosen for. So before going for the process, we usually prefer that the female should have a hemoglobin level of at least 9 gram percentage, because a below hemoglobin level may hamper the recovery process also. So hemoglobin level of at least 9 gram should be maintained before going for laparoscopic sterilization process. Now other thing is, what if the female has done laparoscopic sterilization and if she happens to have some kind of tragedy of not having the last child or death of the child? In that case also, the reversal of laparoscopic sterilization is a little easier process rather than open method of laparotomy of sterilization, because in laparoscopic sterilization, when we do the reversal process of tubal ligation, we just have to remove those two Falope-rings, and after that procedure we just insert the dye and check the patency of both the tubes. If those two tubes are patent, the patient or the female can go for infertility or ART help and can conceive. But if you have adopted laparotomy process or open method of sterilization, because in that process the tubes are basically ligated, we put a suture over the tubes, we take a certain measurement of the tube and we ligate the tube. So it is quite a difficult process in that of reversal. So if you want to, like if you have taken an early step of sterilization, it is always a better thing to go for laparoscopic way. So considering both the benefits of it, like daycare process, easier recovery, and also day-to-day easy care, we always recommend to go for laparoscopic sterilization. I have myself worked at Rajasthan in the district of Sikar, in which they have a government scheme known as Bhamasha scheme, where I have done almost around 400 laparoscopic sterilization in a month of April to May, when they have like summer vacation. So they give the scheme to the people and they give some kind of promotion also to the ASHA workers to make people encouraged to come to the center and do the laparoscopic sterilization. Thank you.